Hello and welcome to Medcity's Secret Mantra to OET. In this video, we'll have a look at OET writing, and the topic I've selected is from one of the comments that we've got from our viewer and subscriber. And we're going to look at how we can select case notes when we are writing the letter to two different recipients. That's going to be an interesting discussion, because selection of case notes is always a concern to many OET candidates. So when we compare how from the same set of case notes, we are going to select the ones that are relevant to write to these two different healthcare practitioners, you will get a fair idea of how you need to select and what are the aspects you need to keep in mind whenever you write to your particular recipient. Because in your OET exam, you have to just write one letter to one reader. But with such exercises or with such samples where you're going to base the same letter to two different recipients, I would say it's a very good method to practice selection of data. So that's exactly what we're going to do in this video. We'll see how we can select the information we require from the set of notes that we have. So let's get straight to the video. Okay, so this is a case note, and the first requirement is to identify who we are. So who am I? Because I'm writing to a healthcare practitioner, but who am I? So here it clearly says that you are charge nurse. So this is my role at a hospital. Okay, now I have a patient and my patient's name is Miss Shaw. Now she was treated at the hospital, but I don't yet have an idea of what the treatment is, because the details will be given in the case notes to follow, but we are not going to read it as of yet. Now she is ready for discharge, which means this is a letter of discharge. Okay, so that's clear from the first two lines before the case notes. Now once I know who I am, okay, and what kind of letter I am writing, now I need to flip the page to the end of the case notes. Okay, this is the second page and third page and four. Okay, so on the fourth page I can see writing task. So in a real exam, like I told you before, you will just have one task to write. But here, to compare and learn how we need to select relevant information, we are going to have a look at two different recipients. So the first recipient of my letter, so I need to write a letter to home health nurse. So this is my first recipient. His name is Mr. Mincer Park. Now as a home health nurse, what is he going to do? He will be visiting Miss Shaw every day. And because it's a discharge letter, I suppose Miss Shaw will be at her home. So the home health nurse will have to go to her house every day. Okay, so I now have an idea of my recipient. Now I need to know what I need to include in the letter that I'm going to write to the home health nurse. Now I have to outline the home care treatment plan. This is one requirement, and management. So this is the second requirement. So I need to pick up information from the case notes that will help Mr. Mincer Park to decide on the home care treatment plan and the management that is required. Okay. Now who is my second recipient? I'm going to write to an occupational therapist. So this is my second recipient, and Claudia Mayhem is the name of the occupational therapist. What do I need to include in the letter to this particular practitioner? I need to outline the home assessment. So this is requirement A, and management. That's requirement B. Okay, now I have a fair idea of the two recipients that I have to write the letter to and what I need to include in the letter. Now before I proceed and select relevant information from the case notes, I need to have a better idea of the roles and responsibilities involved for these two healthcare practitioners, because what a home health nurse will do is not what the occupational therapist will be involved in. So as a candidate, as an OET candidate, I need to have a clear idea of their roles and responsibilities. So a home health nurse will need information regarding the diagnosis, okay, and the nurse will also have to have relevant information from the patient's medical history. So there would definitely be, probably, because we don't know the age of the patient yet. Depending on the age, the patient could have a lot of medical problems, or if it's a young patient, probably no, but whatever is relevant, I'll need to know as a home health nurse. And if there is any complication that the patient has experienced, I have to be aware of that as well, because I have to provide management, like home management, or ensure that the treatment that the patient receives at home is appropriate. So only if I am aware of any complications possible will I be able to sufficiently look after her. Okay, and also of course the medication. Okay, so what are the medicines that she will need to take, and follow-up care. So now she's at home, she's under my care. Anything else that I need to assist her with? Is there any other specialist who will have to come and have a look at her? So these are the kind of information I will require as a home health nurse. But as an occupational therapist, what would I be looking out for? Now I'm thinking from the side of the reader of my letter. What will my recipients expect from the letter? So if I'm writing to the occupational therapist, my occupational therapist will definitely expect these roles and responsibilities, or these information to be included in the letter to this particular therapist. That is, let's say, how Miss Shaw, okay, this is a patient, how she can participate. So I have to help her with her daily mobility at home. So how she can participate in everyday activities. Okay. Now Ms. Shaw has undergone some kind of treatment, so she's not fully alright to be on her own. So how her everyday activities should be managed. So what comes under everyday activities? It could be let's say cooking, okay. It could be about self-hygiene, okay. So these are routine, right, what everybody does. So how I can help my patient participate in these activities as an occupational therapist? I'll have to train my patient, okay, and probably give her some strategies she can use, or maybe let's say techniques that she can use to ensure that she is able to perform her everyday activities. And maybe she would also have pain, so how can she cope with the pain? Okay, so these are the kind of things that I'll be looking out for as an occupational therapist. So keeping this in mind, let's go back to the case notes and try and find out what kind of information will be relevant to a home health nurse and what should be included to an occupational therapist. So we go back to the first page of the case note. So I changed the ink. Okay, so patient details, it begins with the name, Miss Cindy Shaw, 75 years old. So she is quite an elderly patient. So this information will be required by the home health nurse. She would need to know because she has no prior information about the patient. So this is a stranger, okay. Somebody is going to visit her home from now on. So the home health nurse is going to meet Miss Cindy Shaw for the first time. So the name and the age, and even the occupational therapist is new. So he or she will have to have information regarding the patient's name and age. So that's an information that is common across both these recipients. What else? Height, weight, well, not required. Admitted on, not required. Discharge date, not required. Diagnosis, of course, yes. So what is a diagnosis? So let's say how much of it should the home health nurse know and how much should the occupational therapy know about? Well, the patient has had a left hip replacement and it's following a fracture. Okay, so she had a fall. Alright, so again this is common information. So the home health nurse and the occupational therapist both will have to be given information picked from the diagnosis. Okay, so that's about the patient details. Now let's look at medical history. Okay, so as a home health nurse, I'll need to know her medical history, whatever is relevant. So remember we discussed about relevant medical history. So that she is a diabetic patient is something that I'll need to know. Okay, so 20 years, okay, I know the kind of medicine she'll be having, and this is what she takes, no other condition. So this home health nurse will need to know, but the occupational therapist need not be aware of the medical history. So can you see the change begins? Medical history is for the home health nurse, but the occupational therapist need not know about the medical history of the patient. Now let's look at the social background. Well, it says lives with daughter and son-in-law, spouse is dead for 10 years. Spouse is dead is something that is not required. We just know that the patient is going to live with the daughter. We also have to inform the daughter is leaving overseas next week, because we know that the patient is going to be alone. So from this information we know the patient is going to be alone. So home health nurse, yes. Occupational therapist, yes, definitely. To move into a self-contained flat. Okay, so this is an information that the home health nurse will have to know, plus the occupational therapist. So both will need to have an idea of this particular piece of information. Flat has steps, okay for walker. Now this is an everyday activity, right? Walking, moving, mobility. So this is what the occupational therapist will need to know. A nurse does not require this kind of information, so that can be avoided. All routine activities, independent, okay. Exercise, regular walking, 30 minutes a day for 5 days. Okay, so that is not really important, but maybe if you want to mention this to the home health nurse, because she'll have to make sure that she walks regularly, so probably that for the home health nurse, but not to the occupational therapist. Now we move on to the second page, and it talks about nursing management, and date wise you have a load of information given here. We need not include all of it at all, so we're just going to select the ones that are required. Okay, so pre-operative readings. Okay, so this information the home health nurse will need to know definitely, but the occupational therapist not required. The details are not required as such, but probably this, that the reading is good, under control, is an important information. Post-operative, Okay, not really required. Given 2 units of insulin. Okay, probably given 2 units of insulin, IV fluids, pain relief medication. Again, the home health nurse will require this piece of information. What else? Decrease mobility, compression stocking for blood flow. Yeah, maybe you can give this to the occupational therapist. Okay, this piece of information could be important to the occupational therapist, but not to the home health nurse. Able to walk to bathroom with a walker. Okay, again the occupational therapist. Compression stocking removed, not required. Reading at discharge, maybe no. Okay, pain described. You remember pain management is something that the occupational therapist will need to know. So this is again the occupational therapist. Moderate mobility, again the occupational therapist. Home health nurse, not really required. Well, daily dressing required, staples, monitor blood sugar level, all this is for home health nurse and not for the occupational therapist. So good, you can see how there is a big difference in the kind of information we select from the case notes. Now let's move on to the last page. It talks about the discharge plan. So let's select the important details from this. Now the home health nurse will have to know the kind of physiotherapy treatment she will require the patient. So this is home health nurse, but the occupational therapist need not be aware of it. So that's okay. And scar tissue massage, balance exercises. Now all these are information for the physiotherapist. Okay. So and a home health nurse really does not require this information. But if she has to convey to a physiotherapist, of course yes, but otherwise no. Okay. And the occupational therapist does not really require this now. Okay, we have a heading here, occupational therapy. So yes, this is something that the occupational therapist should do. That's a complete home hazard assessment. Okay, because she's be living alone. So yes, all this is for the occupational therapist. Non-slip mat, occupational therapist. This particular information, cost, sock and shoe horn. Well, the cost is not something probably that the person should worry, but sock and shoe horn, reacher, dressing stick and raised toilet. So these are all everyday activities, so occupational therapist should be aware of it. Okay. Needs to be shown how to cook meals, yes, occupational therapist. Placement of food items, occupational therapist. Mild exercises after 12 weeks, physio, not really. Yearly exercises, yearly x-rays, yeah, something that the home health nurse will have to be aware of. Okay. So now we've selected information that is required by the home health nurse and the ones that the occupational therapist would be looking at. So by now you've got a good idea about how not every information is relevant and required for the reader. Depending on his role, his responsibilities in the patient's health care, you need to select whatever is relevant and required. Now let me show you a quick summary of the important notes we've selected, and I've probably I've displayed it as a table so you can easily compare the information that is required and not required. So let's go and look at the comparison. So this is a quick summary of what we've just done. Okay. So a home health nurse, these are the information we've picked from the case notes, and occupational therapist, these are the ones we've picked. So you can see how the patient details is common across both social background is required, but how much information is contained in it is different. Because when it comes to let's say flat has steps, okay for walker, this is something additional for the occupational therapist. Now medical history is important for a home health nurse, for an occupational therapist that is not required at all. Okay, so we will not have a paragraph talking about medical history at all. And if you're talking about nursing management, you can see how depending on the role you have more information and you have less information here. So home health nurse has 1, 2, 3, 4, 5, 6 different points to help the patient manage the home care. Okay, so home care management definitely. But as an occupational therapist, about the pain, about the ability to walk and how much the patient is mobile, that's all. So a lot of detailed information is not required here. Okay, and the discharge plan again differs to depending on whom we are writing to. The home health nurse will need to know that the physiotherapist is required. She knows that the occupational therapist is required, and the rest is what her daily requirements are. But if you look at the occupational therapist discharge plan, I'm going to talk about complete home hazard, sock and shoe horn, reacher, toilet seat, okay, and how to cook meals, no bending, placement of food items. So you can see how the pieces of information that we've selected are all different. So by now, I hope you've got a good idea and you're more confident about selecting case notes. So it's important to first decide who we are writing to, what their role and responsibility is, and what is the condition of the patient. So depending on this, we can select the information that will be relevant to them. So that's all from Medcity's secret mantra to OET in this particular video. Hope to see you guys in the next video. Do not forget to comment on this video as to what else you would be looking out for. Thank you so much for watching this video.